feel depressed. And I'm like, what? 7 to 8 days? She's like, yeah. And I'm like, well, what do you do on the 8th day when you're starting to feel depressed? She's like, I have to delete it. I have to get it off my phone. And I'm like, that's incredible. How much of your feeds on Instagram would you say are uplifting, inspiring, positive in any way? And how many of them would you say are toxic? What percentage? And she said it's about 80-20. 20% are whatever, fuzzy, cute kitty cats and things that warm my heart and uplift my soul. And about 80% of it is absolutely poisonous toxicity. And so then I asked her, well, how many of your friends do the same thing that you do? You know, delete your Instagram when you intuitively notice yourself dropping in to a dark and gloomy mood and mental state.
Let me guess. Is it 0?
She really was like,
Very
I
low.
honestly don't know if any of my friends do that. And I really, really worry about them. And so, you know, I think this is such a huge problem that fits in with all of these things. It's like, how are we spending our free time? Whether we're eating, whether we're exercising, whether we're hanging out with friends. And increasingly, you know, not only are we not getting the physical activity, we're also feeding our poor brains with these poisonous messages through our Instagram feeds and Snapchat and TikTok.
Yeah, it takes a lot of awareness for someone to realize that, especially because I feel like all kinds of social media are designed to suck you in and keep you there. Whether it's YouTube or Facebook or Instagram or TikTok, all of them are just designed to make you feel like you're socializing. And so you're actually missing on that quadrant, like of actually interacting with other humans. It keeps you inside, so you're not interacting with nature. And it keeps you sitting, so you're not moving around. And disconnects you in all kinds of ways. And most of the time, most people don't even realize that it's happening. And I think that's amazing that your daughter was able to realize that.
Yeah, no, it's really wild and almost hard to imagine how in such a short period of time, you know, these are our kids are digital natives. They grew up with the internet and like we never did, but in such a short period of time, you know, this has taken up, like you would know better than me, the number of hours that the average kid spends on social media. I don't know. It's probably 6 or 8, right?
That's
Something
what I saw recently. Yeah, 6 to 8.
crazy.
Other than, say, delaying introduction to social media in children and ideally limiting the amount of time that they're on it, what are some other ways that they can that you can support these pillars of health in children?
I think it's really helpful to know that there are 5. It's not 1 or 2, and it's not 500, right? It's a very manageable number of immensely critical priorities that our bodies need to thrive. And I always say, our bodies actually ask so little of us. They don't really need that much from us, but they need adequate hydration. So, what does that mean? It means my urine is relatively clear. If it looks like Mountain Dew, you're not drinking enough, you're not hydrating enough. Probably the most universal problem that we see in our pediatric population is underhydration or dehydration, and it presents in all kinds of ways. It presents with headaches, inattentiveness, ADD type symptoms, malaise, fatigue, all kinds of things. I just don't feel good. And when you do a urine test on them, their specific gravities off the charts. And so, for whatever reason, and I'm not sure exactly how this works actually, but young kids seem to have like a decreased thirst response or thirst drive. I'm honestly not quite sure why, but I think parents need to like remind kids to keep drinking, especially if they are active. The food thing, you know, that's the second one. I think if we eat outside, you know, the perimeter of the store rather than in the interior, and that's harder to do. But you know what? With a decent cookbook that teaches you how to make really good, healthy, nourishing foods from those primary ingredients, meats, vegetables, nuts, and fruits, it's doable. We recently completed a cookbook with Maria Cooper. I collaborated on that, called The Heartful Kitchen. And what was great about that is we actually included that fifth component of nutrition there, which is the personalized one. So if people are lectin sensitive or histamine sensitive or have autoimmunity or have problems with the gut associated psychology, GAPS syndrome, we have a little key at the bottom of every recipe that says, hey, if you're trying to decrease FODMAPs or lectins or histamines, substitute this ingredient for that ingredient. So that's a handy tool called the Heartful Kitchen.
That's awesome. We'll put a link so that people can find it easily on this.
I think you covered the exercise pillar really, really well. Just like you, we focus on some cardio, some strength, some flexibility, and kids are sort of natural acrobats and natural athletes. So they love to do that, those types of activities that include all of those. And then I think another massive priority is sleep. And, if I was president, the first thing I would do is I would say, no teenager must ever go to school before 10 a.m. I think this idea of making these kids get up at 5:30 or 6 or 6:15 in the morning, it's just, their brains need way more sleep. And, probably 8 is the bare minimum. Many kids may need more like 8.5 or 9 hours of sleep. So to really function optimally. And I think we're just driving them too hard as a society, as a culture, and certainly as an educational system. And that needs to be reformed, in my opinion. So parents are stuck with this, well, we get home late, we go to practice, then we have to do homework and get dinner in there. And then they have to do a few chores, and suddenly it's 10 p.m. or 11 p.m. And they just don't have enough time to get those 8 or 9 hours in. So I don't know. There's no perfect answer, perfect solution, other than to say, this is really a priority that we need to at least be thinking about and trying to prioritize. And then the fifth one, maybe the most important of all, because it's the one that's most tied to our quality of life of all. And that is, we call it stress. But another way to say that is, am I able to self-regulate my autonomic nervous system? Yes or no? And to what degree? And literally, people who can do that well have a very, very high quality of life and well-being in general. People who can't do that well really, really suffer. And stress is not only the mental anguish of stress and anxiety and worry and fear-based emotions, but as we all know, stress also fuels all of our diseases. So it starts with dis-ease, and that turns into disease. And so really teaching our kids at an early age what it means to have the tools, first of all, what it means. We have this thing called the autonomic nervous system that you and I were taught in med school. It's called the involuntary nervous system. That's the term we use, literally. Yeah. And now it's like, well, actually, I can regulate it myself with some very, very simple techniques. And there are many techniques. There's beautiful work on vagal stimulation and polyvagal theory, Dr. Stephen Porges, and heart rate variability, and all of these different neuromodulation techniques that we can use. But a very, very simple one is just learning how to take deep breaths. We are a culture of shallow breathers, and shallow breathing is consistent with being in a sympathetic, hypervigilant, fight, flight, freeze nervous system state. And we want to learn how to move out of that into rest, digest, calm focus, rather than the jittery, nervous, worried, frenetic, adrenaline, sympathetic tone. And so moving out of sympathetic tone into parasympathetic tone is a skill that can be learned and taught. And I think it's something we really need to cultivate for our kids, but really for everyone, including our adults.
Yeah. with kids, we tell them, imagine that you're smelling some flowers and then you're blowing out some candles. And those are the sort of breath movements that make it easy for them to visualize. I just want to go back real quick over these 5 pillars and how parents can really start implementing them even in the first year of life, but especially starting at age 1. And then maybe we can talk about how, if they have older children, how to get back to that. But when children are a year of age in the US, we used to always recommend switching to cow's milk instead of breast milk or formula. And that recommendation is starting to go away. So it's actually better just to start giving them water when they turn 1. If you have a baby that's on formula and they really need that bottle to fall asleep, they need it for comfort, you can start watering it down. You can start with like 3/4 strength formula, in 1/4 water, and then half and half for a week, and then 1/4 formula with 3/4 water for another week, and then just water after that. And it's a really gentle way to ease them into just drinking water. We don't recommend juice really at all in children. The maximum is 4 ounces per day because juice is really just sugar water, and the amount of nutrients in it are so negligible compared to how much sugar is in juice. So really, if you can just start your kids off on water at a year, and you can start with water as early as 6 months when they start eating solid foods, you can offer water at the same time. That's a really good way to get them on that path. With the foods, when a child is less than 5 years old, they have essentially no means of getting their own food. The parents are providing all of the food for them. And so you can start off by offering a wide variety of foods that are all healthy options. When children naturally go through their picky eating phase at 2 to 3, you want to still keep offering a variety of things. And I know it's very easy to fall into the trap of the beige foods, especially in the US, with things like chicken nuggets, French fries, pancakes, toast. A lot of kids will
Mac and
only eat about
cheese,
5 foods,
fish.
mac and cheese. Yeah. They only eat about 5 foods in that age range, but make sure you continue to offer all of these different options because they will, given the choice, start to eat some of those again as well. And with the exercise, just having the culture of we play outside, every day at some point in the day, and children will get used to that and it becomes the norm. The breathing we had talked about, the sleep, helping children, allowing children to sleep and not trying to force them to sleep, I feel like is more helpful. There's a lot of mixed feelings about sleep training and training kids to sleep early, and I'm really not a fan because a lot of it involves some emotional trauma to the child. So rather than going with their signals, you're sort of forcing them to go to sleep. And part of that here is, because parents have this idea of like, I need to put my kid to bed and they need to sleep so that I can then finish up my tasks for the day and have some time to myself to do things. So if you're doing things together as a family, you're going to bed together as a family, all at the same time, I think that can really help to get those habits built in early on. But yeah, with older children, I see some families that parents tell me my kid won't drink water. They don't like it. And so with those, I say like whatever they are drinking, you can kind of start gradually watering that down. If they are drinking juice, make sure it's at least half water or more in that juice. But when you first start off, it's not as sweet. It's going to taste different to them. So it can be a little bit of a shock. But yeah, do you have any other suggestions for like older kids or even adults that have fallen into these? We fall into these patterns, right, of what's easy, and processed foods are easy, and sitting on the couch after dinner is easy. How do you
Yeah.
get
Wow.
that motivation and momentum going?
I mean, beautiful overview there. I think this idea of like you're really calling out this idea of listening to one's own body, learning how to intuit what you need, whether it's my child actually needs to sleep in my bedroom for a while and we need to co-sleep for a while as we gradually get more comfortable again regulating the nervous system around the idea of sleeping by myself, to the idea of being connected to my body so that I understand that Tang or Kool-Aid or the kind of juices that come from concentrate or Capri Sun drinks and things, high C and all these things are full of chemicals and dyes and flavorings and colorings that do not exist in nature. They are, at best, enhanced with natural flavors and colors, but the bulk of them are synthetic chemicals that don't exist in nature. And so that first step, Carol, is so important, is just to create a sense of understanding that our goal is to feed our body or provide our body with what it needs. And most of those things simply come from nature. We moved from a time when the big concern with infants was failure to thrive.
Mm-hmm.
And we would see these little babies or 1-year-olds or 1.5-year-olds, and they were just super thin, super skinny. They were falling off their growth charts. And honestly, like, I don't see those kids anymore. They're, the incidence of that problem is very, very, very low, at least in my view, from what I can see in my patients.
Yeah, I've
Um,
noticed the same.
yeah,
And
where
but what we do see is kids that are overweight yet malnourished, if that
that's
makes sense. That
well, that
they,
totally makes sense. And
yeah.
this is where, again, educating the parents. There's so many times where I see grandma and mom come in, and they're just fussing with glee and delight over how cute their baby is when they're really, really chunky. And sure, you don't want your baby to be thin, that's for sure. But there is a point that you're making, which is this child actually is moving down a path that is actually pretty dangerous, and it's going to set them up for a metabolically dysregulated life. So what are your methods of discerning like a healthy chubby baby from someone that's maybe overdone it a little bit?
Really, I have to just dive into their dietary history and also the parents' sizes when they were that age. If they were, if they were like chubby kids that then became a normal average weight when they became, went through puberty, became adults, I'm a little less concerned than if they were like, we were really tiny and our kids really big, or we were really big and our kids really tiny. Like those, when the genetics are different like that, I worry a little bit more. But I've also noticed that our culture has really become one of there's always a snack for the kid on hand. You always have at least, 1 to 5 snacks in your purse, in the diaper bag, just in case your kid gets a little bit hungry. And they're giving them breakfast at school, they have lunch at school, and they have afternoon snack at school. And then they get home and usually have another afternoon snack and then dinner and then dessert. And we've really gotten into this habit. Kids that do any sport event ever, one of the parents needs to bring snacks for them after their 1 hour of activity, playing a game of, soccer or basketball or anything, any kind of sport activity. We have this culture of like, we have to feed the kids to replenish that lost energy. And I mean, when I was little, I remember there were times when I felt hungry, and that was normal. We had 3 meals and we had after school snacks. So we had sort of 3.5 meals in the day. But that just isn't the case anymore. And even if you're giving your children healthy things, like I had a patient in residency who was a young child, 3 or 4 years old, who was obese. And the mom said, well, I only give her fruits and vegetables, and pulled out a gallon-sized bag of watermelon chunks, another gallon-sized bag of grapes, and I think like 3 or 4 other, snacks like that, where we're just saying, this is a massive amount. Is that for the whole day? And she'd say, no, this is just for like the morning, or, it's just part of the day. So it is possible to overdo it. And I think some of the best advice I had heard summed up was eat food, not too much, and mostly plants. And that's sort of a good, healthy guideline of, you want to like go towards those more naturally occurring things and in a moderate amount, not to the point that you're stuffed and not continuously throughout the day.
Mhm. Yeah. And I think that's why, to your point, I completely agree. When we look at the pillar of nutrition, it's not one thing, it's 5 things. So, what is it? Where does it come from? How much? When? And the personalized stuff. And how much means even the healthiest diet, it's composed of the right things from the right sources. Healthiest possible diet for that individual person. But you can still either eat too little and undernourish yourself, or eat too much and overdo it. And so listening to those body cues is really important. I think that just like with social media, food is falling into this category of this is actually how I self-soothe. I've taught myself, not consciously, it's just what's happened, but I've taught myself and trained myself that when I'm nervous or worried or tense or anxious in any way, I need to self-soothe. And so what do you do that? Or what do you use to do that self-soothing with? Well, it's either social media or it's very, very high glycemic index foods, typically. And, or it's whatever, online shopping and later in life, alcohol and nicotine and all these things. But they're really used by all of us to some degree, oftentimes in ways that we're just trying to tune down the overstimulation of our nervous system. And as a culture, we just have to call that out and say, hey, this is what's happening. And to then begin to think about, all right, if that's so, are there more healthy ways for me to calm down that nervous system when I'm feeling anxious?
I had one last question for you about vitamins and supplements. And I've heard it said that you can't out supplement a poor lifestyle, which I love. But also, I usually don't recommend vitamins and supplements for everyone. I think when children are going through their picky eating phase and they're not getting enough of the micronutrients, that's a good time to add in a multivitamin. But really, outside of, say, ages 2 to 3, I usually don't routinely recommend vitamins like on a daily basis. How do you feel about vitamins and supplements? And I know some of the supplements are more that sort of individualized, like if you can't eat certain foods or you can't get enough of this nutrient, then you need to supplement what's missing. But if you can supplement it with what you're eating and with food, I think that's a better option, right?
Hmm. Unfortunately, the standard American diet, called the SAD diet, not only comes from a lot of non-real food sources and substrates, synthetic things, the artificial things that we talked about, but whatever is natural within them um, is limited in its nutrient density by the depleted soil that those plants are grown in. And oftentimes even organic food, but certainly conventionally grown crops are absolutely hosed down by all kinds of pesticides and herbicides. And so the overall food quality of our country has declined significantly in the last few decades. And therefore, I think we're oftentimes past the point of saying, you know, fish oil is good for you, or vitamin B is good for you, or vitamin D is good for you. And I think we're moving fairly rapidly, and certainly in my practice, we're doing a lot of this testing, which is personalized nutrient evaluation. And so there are labs now that can do very, very detailed analytics on any individual's precise nutrient needs at that time, not just vitamins, but also minerals and antioxidants. And then it also assesses for those toxicities that I mentioned. And many of the toxins that we ingest come from our food in the form of everything from PFAS chemicals to phthalates to the BPA endocrine disruptor plastic compounds, microplastics, to pesticides, etc.
Heavy metals.
And heavy metals, right? So
Yeah.
from fish, we get a lot of potential mercury exposure. So
Mhm.
so there are tests that don't cost terribly much. And for people that are interested, for me or for my child, what are the particular supplement needs or the vitamin needs at this moment in time? And that can change over time. That's probably the best way, in my opinion, to do it, to really customize it on the basis of what your lab data actually shows.
Yeah, use the science, right? Find what's missing and then fix that. I
Mm-hmm.
like it. I
Mm-hmm.
think also because this podcast is international, there's people listening all over the world. eating foods that are local to your area are probably more in line with your genetics, right, than things that have been grown across the world and shipped across. And I know also, like, a lot of the produce that we have in the US that is shipped from far away, it needs to be picked early so that it doesn't over ripen by the time it gets to the stores. And when you pick it early, it just doesn't put down as much of that nutrition, even if it was in good soil, which a lot of the times, like you said, it's not. Like, we don't have as many nutrients in the soil as there used to be. And so even our produce is sometimes not enough for our bodies. And I mean, if you can grow your own food, that's amazing. If not, if next best would be finding something that's local. And then outside of that, finding something that is grown in nature from a different place. And then last on the list is those, processed center of the grocery store type of foods.
Yeah, Carol. I think if there's one thing we could do as a nation to improve the health of our country, it's to support local regenerative agriculture, support farm to table restaurants, support farmers markets, support CSAs, because they're connecting all of these dots. They're growing real food. They're sourcing it in the right way, whether it's plants or animals. They're doing it in a conscious way. They're doing it without chemicals and pesticides and herbicides. And they're doing it exactly as you say, both locally, and they're very mindful of the quality of the soil, much more so than, big agriculture. And it includes that very important principle that you mentioned, which is not just local, but also seasonal. So is something in season? Is it ripe? There's a big difference between, a cultivation that's based on things that are in season at this moment in time. American medicine doesn't spend a lot of time on this, but certainly the practice of Ayurveda and some of the Asian traditional medical practices spend a huge amount of emphasis on the importance of cycling, not just between when I eat and when I don't eat. So they include a lot of fasting practices, which I think are super important and healthy for all of us to learn about and know about, but also this idea of food seasonality, ripeness, and that probably has a phenomenal impact on our microbiome in a positive way if we're eating in coherence with those seasonal cycles in our particular environment.
Yeah, that is excellent advice. Yeah. Well, thank you. I think we have to wrap up, but it was so great to talk to you and get your perspective on all of these ways that we can keep ourselves and our children really healthy. I'm really inspired by this talk. Mm-hmm. Any other closing comments you wanted to make?
Well, it's a pleasure to see you again, Carol. I wish you well. I send many blessings of health, healing, and happiness to all of the listeners. And stay in touch. We're at cloudmedical.io in Boulder County.
Thank you for tuning in. Make sure that you like and subscribe so that you can be the first to know when new episodes come out. Also, you can check out the first 4 seasons of the Baby Manual podcast on your favorite podcasting platform, or check out my YouTube channel for lots of videos and shorts that will help you feel empowered as a new parent as I answer all of the common questions that tend to come up in the first couple of years of life. Have a wonderful day.